While everyone's getting on, I just wanted to say good morning.
Good morning to you too. How are you doing?
I'm good. And good morning to everyone that's joined us virtually. Super excited that we're talking about all things COVID-19 / temperature screening. So there's a lot to tackle, but just real quick introductions again. My name is Josh Templeton. I head up our revenue program here at Aduro, and I'm joined today by Sean Bell, who is also our Chief Operations Officer. So we say good morning to you all virtually, and good morning again, Sean.
Good morning.
So I thought what I'd do before we jumped in is I just wanted to orient around how quickly things have changed, even just from 5 weeks ago. And it's interesting organizationally, just for some context, we have received on average, anywhere from 3 to 10 RFPs on any given day and or week regarding temperature screening. So it's been amazing just to see the organizations are trying to candidly figure out, they're trying to sort through how to solve for this challenge that COVID-19 has put in front of us. And what I would say, but as we think about, everything that we're going to talk about today, one thing I always want to I think it's important to state is, even though that it's estimated that anywhere from 30 to 50% of COVID-19 infected individuals are asymptomatic, it's important for employers to identify every possible COVID-19 infection that they can and to maximize workplace safety. And so, it's kind of in that spirit that we've seen not only this shift in needs, but it's also, I think, just a really important topic to jump into today. And the other thing I was going to say was, we received through this RFP process, and Sean, I know you've tackled this as well. We've received so many questions around what is a proper temperature screening program, what goes into it, what are the truths, what are the myths, what are the things that organizations need to be assessing and strategizing against. And so there was such an influx of not only requests for information and requests for proposals, but there was so much information out there. We as a team said, it's important to kind of get everybody on, at least from our lens, on the same page in terms of what temperature screening should look like, what are the types of outcomes that it should drive, and what could great be for organizations as they think about this both now and long term. So what I thought we could do, Sean, is maybe to start off with, I would love to get your perspective on if you were to think about what a great program could look like. I'd welcome your thoughts on what goes into a great temperature screening program.
Yeah, we have Erica just put up a nice graphic that sort of captures some of the elements of it. But before we jump into the specific elements of it, let's take a step back and talk about how you think about any great change and how you enact change in an organization. If you take some steps back and you think about some other examples of areas where we've had a sea change in process and perspective, one of the unfortunate examples that definitely rises to the kind of almost the equivalent of what we're doing here is 9/11, when we had to put a massive screening and security infrastructure in place that really, for a lot of people, felt very intrusive, very rapid, very questionable about whether or not it was capturing the outliers that you had to be careful of. And there were just anecdotal stories of my grandmother being quote unquote randomly screened in her wheelchair, and people were furious about these things, and my small bottle of water being taken from me, and and so on and so forth. And the point behind all of that wasn't to argue whether or not those processes were necessary or effective or worked or didn't work. The problem was that we rapidly changed a process that people were very accustomed to in a way where they lost control and lost a lot of autonomy through that process. And because of that, there was incredible resistance in the beginning, and there still is in a lot of ways. People, and when you feel a loss of control, your anxiety levels literally shoot through the roof. And then there becomes this negative feedback loop. The anxiety makes you feel less in control. the less in control you feel, the more anxious you feel. And then that just leads to, a real hostility towards trying to do the right thing, or to act in a rational way. So when you think about these return to work policies and screening policies, it's got to be more than just thinking through something as basic as, okay, how many screeners do I need to have at the door? That's a really good question, and we'll talk about that. But your first question is to actually try to get yourself in the mindset of people who are already anxious, already worried, already feeling a lack of control in their lives, and thinking about what this layer is going to mean to them and how to adapt what you absolutely have to do, which is provide some reasonable level of protection in your work site for employees to avoid incidents expanding or growing, but doing it in a way where people feel bought into that process. So I want to talk about that as we go through it. But at the most basic level, what our point of view is that we've really been working with clients on is essentially looking at this from a threefold perspective. Point number one is wherever possible, have people screen from home. Now, when this very first got started, there weren't any, the line had to be drawn. And in many ways, still, it has to be drawn at the door of the workplace. Digital tools are evolving quickly, but, we're seeing nightmare stories coming out of Utah, which try to, quickly go with some company that hadn't had any experience in this area. They built some mobile app and it's not doing what it needs to do, which is give them basic reporting, and they're weeks behind in that process. And so there's a lot quickly moving and improving, but phase one, was really focused being at the door and thinking about how you're going to keep people from getting in. And that's always going to need to be there because there's always going to be outliers to your strategy. But as quickly as possible, we need to start moving away from having people, being screened at the door with the potential they're exposing to being screened where they can at home. And that's where a digital screening process is starting to become very rapid.
Yeah, really quick question. Actually,
yeah.
The comment you made around the shift after September 11th and TSA and the whole process that went into place, what you just said around screening at home, my mind would go to, you're not only you giving them the ability to do it there, but what you're also giving them the ability to do is to be comfortable and that they feel like they can do it in a less intrusive environment. Would you say that that's also a natural byproduct of all of this?
I think it's a great call out. I hadn't really thought of it that way, but you're absolutely right. People will be calmer. People will be more apt to be thoughtful about, let me assess how I actually feel here. Now, once again, you have to think broadly about this. Asking people to screen at home or answer and self-attest at a survey at the door, a prerequisite of that is that they feel comfortable being honest. If there are negative bias built in, for example, I know I'm going to be, I have a chance at losing my job if I don't come to work, or I have no sick leave policy, and if I don't show up to work today, I don't get paid.
Right.
And people, by definition, will ignore symptoms in order to justify getting in because a primal need is to feed your family. A primal need is to pay your rent. So you have to think about your policies as they relate to these processes and say to people our primary goal is keeping you and your coworkers safe. In order to do that, we need for all of us to be upfront and honest and a little vulnerable about how we feel and how our symptoms, if we see any, or if I've been exposed, I want to be able to speak up about that. And I want to know I'm going to be able to be cared for in a reasonable way. And so by creating that sense of trust and then allowing people to do things where possible from home, you're giving them the ability to be more thoughtful and calmer and a little bit more reflective. And I think you're going to get a lower incident rate and much higher level of compliance on honesty.
Right. No, that makes sense. So a question that oftentimes comes up is what's the level of information? So you just talked about kind of this idea of testing at home, and Sean, when you think about what should companies be asking in kind of that first step, right, which is keeping people at home, what kind of information should they be asking, right? This is kind of one of the myths, and there's fact and myth in this, right, which is the Centers for Disease Control have a fairly lengthy kind of series of questions. Is it as simple as, do you feel like you have do you have a temperature or not? Is that simple? Or are we talking they really need to go through top to bottom this full list of kind of Centers for Disease Control type questions?
Well, unfortunately, given the way COVID-19 is expressing itself, the reality is not any one question is going to be adequate. Temperature simply isn't adequate. We've seen enough people who've not had a fever, but have turned out to be COVID-19 positive and they've had other symptoms. So the CDC really has developed what is sort of the best practice right now. I believe it's about 6 or 7 questions. We've built it into the digital screening tool that we launched this week. It actually is not that onerous to fill out. It takes about a minute, and you can do it in some fairly binary ways. Like we ask people, for example, have you been exposed to anybody? Question 1. 2, do you have any changes from yesterday? And if you have, then we can go through those questions. So a lot of it is by giving people comparables, because that's an easier way for them to think about things. Asking them like, I have really bad hay fever. And so I've known like for February, March, and April, like I've had to deal with this sort of terrifying every morning I wake up and I'm like, is it my chest tight because it's just the alder trees, or do I have COVID?
Right.
But I take my anti-allergy meds and it goes away. And I'm like, okay, I guess I know it's hay fever today.
Yeah.
But that level of like constant thinking on that. So what we're trying to get people to do is focus in on symptom checks that have them compare, okay, is your cough worse than normal? If you do have chest tightness because you have asthma, is it worse than normal? And so those symptom checks are good science. They make sense. And if we're asking people to attest to 85% of their symptoms at home, having them check their temperature with a thermometer at home isn't crazy.
Right.
And you could, of course, then bolster that with a quick forehead screen, a touchless forehead screen at the office, which a lot of people are doing as they're layering this on.
Yeah.
So, yeah.
Well, it's interesting, right? So let's kind of roll. We're following this path, right? So let's say an organization, they've been able to virtually attest for their employees. So they're taking that quick survey, and so let's follow that path. So we then the next morning, I go to head into work, and this organization is they've decided to put a temperature screening in place. Can we talk a little bit about, talk a little bit about what that process is like, and as you think about maybe that second step in, you've gone from keeping people at home to now we do need to be in the office, we do need to be in that location. What happens then? Like what goes into that? And I'd love your thoughts.
Well, first, you did say something I want to quickly correct. You made it sound a little bit like, okay, they would do that the night before. They would do their survey the night before and the next morning. We actually recommend they do it 2 to 3 hours before they show up to work, because the symptoms seem to actually happen rapidly. And so we don't think actually 10 to 12 hours in advance is going to give you as much useful information as that morning. So someone shows up, and what we're ideally working with is a scenario where we're able to create a layout for people where they can socially distance on their way into the office. We really want to avoid clustering at the door. So one of the things that we've done, that we've developed a methodology on, is to try to understand the number of people who are going to be coming in the door at what period of time. If it's shift work and everyone needs to be on the line at a certain period of time, there has to be more screeners working at more doors. You have to assign doors to people, have them come through, and so you can actually create a flow through. When people are screening on site and they have to go through the survey, it takes roughly a minute to a minute and a half to look and read at a laminated set of questionnaires that we show them and say, do you have any of these symptoms? And then do a quick screen. And then we give them a color of the day. If they're wearing a protective clothing, it's sometimes done as a sticker. We've even had to do work in clean rooms, so we've had to develop methodologies for that. But in many cases, if it's usually a sticker, particularly if they're in the manufacturing line, because you do want to avoid with that bracelet something that could get snagged. So they go in, they get screened, no symptoms, no temperature. They get their badge, off they go, and they're done for the day. They don't need to keep getting rescreened. If they have any symptom, we have them step to the side where a concierge asks them a couple more questions, and then gives them the written guidance that Human Resources has provided, which is usually to go home and to isolate, with a follow-up to a primary care provider. We do not say, nor should any screener say, I think you have COVID, or you have the symptoms of COVID. These are not medical personnel. They have medical backgrounds, but they're not doctors or nurses. And so we've tried to be very, very clear, but we're not diagnosing. That is the job of a medical professional. All we're simply saying is that because of this symptom, you are not meeting the criteria to enter the office today. No problem. Head back home. Let your human resources manager, or whoever your contact on that list is, know, and then follow up with primary care. And a third step now is increasingly telling people where they can go to get tested to know definitively should they have this or not. So that's the actual process that takes place. Now, if they're doing it from home and they've screened at home, they show up, the process is much faster. They have a digital app that's got essentially the equivalent of a fast pass on it, a green, they shouldn't have showed up if it's red, because they had a symptom. Shows up, it's green. They show it to the individual. Some of our clients are asking that we still do a touchless forehead check on the way in. Happy to do that. Do a quick thermometer scan, and off they go. That takes about 15 to 20 seconds per person. And once again, now they've got their digital badge. They don't need to actually be able to have to have a physical badge on them, because if someone says, "Hey, just double checking, we're scanning," but some companies are actually relying on badges anyway, so those uncomfortable conversations don't need to happen.
Yeah, it's interesting, because one of the questions that we receive frequently is, it's two parts. So the individual that goes through the screening, and you had mentioned a little bit of the process that you go through if you're green and you get a pass and you go in. And the second part, though, is a lot of times organizations are asking, and they ask us frequently as well, is what do you do if somebody actually does have a temperature, or they say yes to one of the survey questions? And so there's this two-part question. So part one is, when you talk about kind of the ability to pull them aside, it most certainly has been an interesting conversation with a lot of organizations around policy, procedure, how do you do it in a thoughtful way? And then the second piece of it is, let's say you are going to do that. And there was a great question that was asked, which dovetails off of this, which is, if they do show those symptoms, or if they have those symptoms, then is there a place that you take them? Is there a process? So I'd love your thoughts on that. It's a unique scenario, but I'm sure it comes up.
Yeah, and I'm going to give the best answer I can on that, because this is a moving target.
Yep.
So should someone show up, this is one of the reasons why, like, we've actually been very insistent that our screeners actually have a full set of PPE. We've had some personal protective equipment. We have had some clients who have been using internal staff, such as their security guards, or have worked with temp agencies. Though no disrespect whatsoever to those approaches, but the issue in there is that you have someone who's non-medically trained at all, and doesn't even necessarily know how to wear PPE appropriately, and you're deliberately asking them to then put themselves in line to be exposed in that case. And so I haven't seen any data to say incidents are higher amongst these people, but I just think it's a caution sign if I'm going to ask somebody to step into that. And that actually gets to the question about isolation room in a minute. My thinking, the thinking we've sort of evolved on this is, isolation rooms in a employer organization are never going to be quote unquote isolation rooms. They don't have negative vacuum. They are not sterile. And we do not know, like your cleaning staff does not know how to medically sterilize when someone has an infectious disease in that room, particularly something that has a respiratory, is based on a respiratory connection. If that happens, what we do, if someone has a symptom, someone in PPE has them step out, and we very quickly, like in 2 minutes, ask a couple of questions, give them their paper, and send them back to their car and get them gone. That's not to be rude. That's not to be brusque, but it is, our focus is, the workplace is not designed to allow people who have symptoms to actually linger. And we want to get them out as quickly as possible. Now, dedicated room to do that is fine. You can go in there and have that done, but then that has to be cleaned every single time. Because I have a symptom, I go in, I talk to the person who's in full PPE, that person comes out, they can change PPE, but you can't change out the room. So I would, recommend, we've actually had people who've actually chosen to do this screening outside. So people aren't actually getting in the doors. And so it's a little bit less of a problem, because otherwise you're going to have somebody on standby to clean that room after that individual is there. So when the next individual comes up who happens just to have symptoms that turned out to be hay fever, you're not actually getting them infected because they were in a room, they put their hand down on a chair, etc. People are so anxious already. We're trying to really limit on that. That's not a great answer. There's not an ideal answer, but the ideal answer is as quickly as possible out. Isolation rooms where anyone's going to linger or try to talk or say, let me make a phone call, just increases the likelihood of a event happening.
And what's interesting too, and I appreciate your answer, Sean. And what I think is really interesting is the questions that come up frequently for organizations as they go through this process of identifying how they want to tackle this, what are the tools that they want to put in place, what are the policies and procedures that they want to outline, and most certainly opens up a myriad of other scenarios, right? So, we're hearing, and you can read it on the news where individuals they don't want their temperature taken, right? And so there's those scenarios. There's some organizations that are saying, they're aligning with, they're trying to align with different types of policies and procedures that are coming out from the states, and it can vary by state. One of the common questions that we get as an organization is, what are the standards by which we use? Because some states are using 100.4 and others have gone lower than 100.4. And so, what in what instances, and how do you track all of that? So a question that I wanted to get some perspective on, and this is one that I think that it kind of moves into another area, which is, when you think about temperature screening and you think about the pre-screening process and then the temperature screening process, that's most certainly a specific moment in time, right? That's, as you are either the day before, the morning of, or that period before you head in. But then what's interesting is you pull the lens back.
Yep.
And you really start to think about this longer term. How do you, what are some things that you would want us to think through, and organizations to kind of chew on as they think about this as a part of a broader and a longer term strategy, especially now that we're starting to get more and more data that says this is going to be here for a while. And so I'd love your thoughts, and have maybe walk us through a little bit of that longer strategy and how it kind of becomes a part of their organizational ecosystem.
Yeah, it's a good question. And so I think there's sort of three elements to that to keep in mind. Before I jump to that, there was a follow-up question, though. There was an issue. I just want to tie off on something around this issue of exposure. Mm-hmm. The way we think about exposure is what I call the 3Ds: density, duration, and distance. And so as you're thinking about ways to minimize at the door or minimize on entry, you want to think about those 3Ds. Densities, you do not want clustering at the door. So you have to work either with your internal folks or whoever's providing this to ensure you've laid out a clear process. Number of people you expect to show up, frequency of their showing up, what the throughput could be versus overall capacity of any one person. You really want to think through throughput. That's so you can manage density. Distance is about making sure that you're not having people, waiting too close to each other. So marking off how you want the lineup to work, making sure people understand if they're 12th in line and they're going to be 5 minutes late to work, they're not going to get, necessarily dinged for that because of the process. And then duration is how much time people are have to be close together, and how much time can you limit that down by speeding that. So I did want to tie that off because there was another follow-up question that showed up in QA around how do you kind of do that. So I just want to make sure everyone should be focusing on those 3Ds. They're a good paradigm.
No, that's great.
But getting back to your larger question there about this new normal. Okay, so let's just be upfront and cut to the chase on this, because it's a fairly frightening topic. Mm-hmm. So what we've seen happening at a national level is essentially a political bent now taking about around public safety. Mm-hmm. And I really don't care one way or the other where you fall on this. Whenever you try to mix politics with public policy, you're going to have some conflicts. Right. So yeah, the question has to be, the way I've framed it up and the way we've talked about it in conversations, is less about how the politics of the discussions are going, and more about the culture of the company you choose to offer, and how you choose to run the culture of your organization, and what that culture is, and what the level of trust and what the level of accountability is to one another in that organization, and how do you bring that story to life. Now, as it relates to policy, I'm not suggesting at all you don't pay attention to it. And our recommendation to people is, when looking at conflicts between locale, state, and federal, go with the most conservative rather than with the least conservative. That's the approach, for example, every human resources person has to take when it applies to things like how to categorize an employee as a 1099 or a W-2. Depends, federal guidelines are one. It has to do with drug policy. You have, federally, marijuana use is not allowed. In the state of Washington, it is. So you have to be thoughtful about, okay, you have different policies. So how do you work around that? We've had to deal with this in other areas before. So I just tell people, go with the least, not with the least common denominator, but the highest common denominator, and you should be okay. But as it relates to this question of culture, rather than, this gets to this TSA question, people feel much more comfortable in being engaged in something when they feel that they're doing it because they're accountable to their coworker. And they owe that to their coworker, and their coworker owes it to them. And that approach takes what is a messy public policy of politics and where you stand on the divide between these things to one that's much more personal. I have an example that I use with it. I have a friend of mine from high school who is a totally different political bent than I am. We think completely different on things. My mother lives in a fairly rural area of the state she's in, and the grocery delivery broke down because of COVID virus. They couldn't get people out there. And I was desperate. My mom's sick. She's older. She can't get out. I was very desperate about making sure she could get, and I put a call out, and the person who raised their hand first was my friend who has the biggest political divide with me. And this person drove to the grocery store and shopped for my mom and got her groceries and got them delivered and put them at her doorstep and did a no contact thing and walked away, made sure she was able to get the groceries, get them in, did it all.
It's amazing.
And that's what we're all about in the end, right? That is absolutely what we're all about. Is we, at the end of the day, when you take any individual and you say to them, don't think about how this affects globally, think about how this affects individually. Everybody steps to the plate. And so that level of accountability is what we've applied here in thinking about the culture of how these policies are going to play out. So as you think about how you survey your folks, how you get them engaged in discussions, these are areas where you can actually get them engaged and help them feel part of the solution rather than being a victim of the process. Yeah. And so what we've really worked with people on is thinking about this, about that, because of asymptomatic transmission, you absolutely have to continue to maintain some of the social distancing policies in work. You can't not do it. And so, along those lines, even if people are 100% come in and they're all clean, not clean, that's the wrong word, but they aren't showing any symptoms.
Sure.
So what we really want to do is continue to encourage strict following to things. And this is what we covered in our last webinar, which I know there's a link in there, so I won't beat that to death. But that is really an important element, is maintaining those policies and doing it in a way where people feel bought into this process. Screening is not going to go away anytime soon. Right. You're going to have to wear a mask in Costco for the foreseeable future. You're going to probably have a touchless forehead screening happening somewhere. And your workplace is going to have to be focused on maintaining a adequate set of processes to avoid incident rates and hotspots ending up to the organization being closed down.
Yeah. Well, I want to hover on a comment that you made, and I think it's a really important one, which is this idea of alignment and organizational buy-in. Yeah. And it makes all the sense in the world when you think about remote screening and then on-site screening. Because I think your TSA analogy is a really, really important one. Because when you think about what the Transportation Safety Administration has put in place, is they're trying to keep us all safe, right? And they're trying, and so we know that as we all go through that process, we'll say as vigorous as it may be at times, is we know that the greater good is we're all making sure together that we are safer. And I love that the way you teed that up, and I think that that's a really important takeaway from our time today, right? Which is, the culture of the company is key, and getting people to buy in is so important, because when they do, it's no longer about, it's this thing that I have to do. I'm doing it because I'm a part of the greater good, and I'm a part of this overall strategy to help make this place safer and better for everyone. And, and I really like that as well, because I think that it helps take away what I think you said it right, which is some of the angst and the fear and the uncertainty of what it actually is. And we actually take a step back and say, we're all going to be better off because of this. And yeah.
No, I think you're spot on. I actually, let me give something else to sort of think a little bit about. Where people have a tendency to really fall apart on processes when they feel it's arbitrary and capricious. And yes, I did just quote straight from a Seinfeld episode, and you can try to guess which one. But arbitrary and capricious is not good, and people feel disempowered by that, and their reaction to feeling that is to react, usually negatively. So, a consistent, transparent approach to what you're doing and why. One of the things that the construction industry has done so incredibly well is have been really upfront about workplace injuries. When they have that big sign out front that says 0 days since our last injury,
Right.
they've just announced we had an injury. They
Right.
don't try to hide it. They don't try to, they've tried to create a sense of ownership a little bit. Like we're all in this together. Like this is something we're trying to do.
Yep.
And I think it's completely, there's been a lot in the news about the differences in perspective around whether or not to share information on incident rates of COVID in an organization.
Right.
I believe you have to.
Right.
Because I think it helps people understand. It creates, at one level, creates fear, and you have to acknowledge that and own that fear. But people get way more fearful with a lack of information and they do about having information that is as accurate as it can be, that's contextualized appropriately. Right. In a vacuum, people will go to the worst place. Right. And so, having something that's saying like, look, we've had 5 people who've had symptoms, and because of that, we're going to be even more focused on, we're going to be sending more reminders out about keeping the place clean and wearing a mask in the kitchen area when you're preparing food, and keeping 6 feet away from one another, and managing meetings. We've seen a couple people maybe, moving away from that. And that's the sort of stuff that I think really matters to people, is they feel a sense of like, okay, I know something's not great, but at least I know. Yeah. And my company's being transparent with me and has asked for my assistance or my input on how we could do things better and what processes we could do better. That's where it really starts to play itself out, where screening it should not be considered arbitrary, and it should not be considered capricious. It's there to protect all of us. It just has to be done in a reasonable way that is fair and works quickly, so people don't get unduly stressed. And that's why this hybrid digital screening with on-site, like right now, I would say the vast majority of our clients are weighted 85% on-site and 10 to 15% some level of electronic. I expect that's going to switch in short order, and we'll have 80 to 85% using our digital screening and 10 to 15% of that happening at the door. Yep.
And one thing, and I want to make sure we end on time when we think about kind of there's so much to this, and you've touched on so many great points, whether it was, how do you embed it into your culture? I loved the 3 Ds as organizations kind of take some things away. So just a kind of a quick recap, and then I will most certainly make ourselves available and follow up for any additional questions. But, we set off with our goal today really to talk about temperature screening, how you can tie it into your broader strategy, some thoughts around what a process could look like. We received some really great questions around some of the subtleties and nuances of that. And so I love the 3 Ds, right? So we'll kind of recap, right? Remember, you want to be thinking about from an exposure perspective around density, duration, and distance. And then we also talked a little bit about how you think about this idea of screening your employees as a part of your culture and your process. One thing, Sean, I know coming up, there's going to be on June 2nd, there is a SHRM webinar when it gets into more of the specifics around when to test and what to test. So I think it's a really great leave behind for the broader group. So if you have time, we'd love for you to join. And it's going to be, I think, a really great conversation around some of the more specifics, around some of the specifics that you talked about. But I just
as a shout out for that.
Yeah, please.
Dr. Michael Todd will be joining us. Dr. Todd has been involved with employee wellness. We ran he ran the global employee wellness program at GE, and now he is a senior member of the clinical and business organization at Bon Secours Mercy Health, one of the leading hospital systems in the United States. And his organization has he has a group that actually has been running a lot of the validation tests on the accuracy of the PCR virus test and antibody test, and now antigen tests. So he's going to be working with me to go through all of that, talk about it, how it's used, when it's used, should it be used, and I think it'll be a great opportunity. And there was a question as to whether or not we'll be providing more information about the home screening app and tool. yes, we're happy to do that. We didn't want to turn this into an event to talk about anything too Aduro specific. So we'll do a follow-up if anyone has any questions about that. But yeah, happy to sort of talk through about the elements of that and where it is today and how we think it should evolve and how those tools should evolve in general.
Yep. Well, Sean, I enjoy these little webinars that we've been doing. Thank you so much for your time, and also for every attendee that joined us today. Thank you, and please continue to keep your questions coming, and we will continue to tackle them as they come in. But we will wish you well. We'll say thank you again for everybody's time today, and have a great rest of your week.
Take care, all. Thanks, everyone.
Thanks so much. Take care.